Welcome you back to Public Affairs on Peach this morning, and we are talking about breast cancer. And my guest this segment is Dr. Kirti Gogineni from the Winship Cancer Institute at Emory University. She is a medical oncologist who specializes in breast cancer. Thank God for you and those like you, I tell you. And we begin with something that came out in the last couple of weeks, a study that found that black women are 43 times more likely to die from breast cancer than white women. And in that study, of the 50 U.S. cities, the biggest disparity was right here in the ATL in Atlanta. So let's talk about that. What about black women who are really major breadwinners in a lot of their families have really limited their time for doctor's appointments and chemo and radiation? What does that study say about why it is black women are so susceptible to breast cancer?
It's a great question. So the study was describing what the trends are in the largest cities in the United States. And it was looking specifically at the differences in death rates from breast cancer among black women and white women. And in Atlanta, black women were, over the past few years, 30% more likely to die of breast cancer. White women were 30% less likely to die of breast cancer. That's a huge difference. Huge. I think your point about black women being the breadwinners and the champions in their family, this is exactly why they have to put their health first. You know, they have to be there for everybody else. That means you pay attention. If you feel something that doesn't feel right in your breast, you get your screening mammograms. You know, attacking a diagnosis of breast cancer early gives you the best chance for cure and for surviving. And so this is not optional. You got to pay attention and take care of your health.
So is the adage, put your own oxygen mask on first, and then you can help other people, as opposed to, I'm gonna help everybody else, and then I can hold my breath. I can hold my breath, and I'm gonna help everybody else. How do we get us to flip that script and say, no, it is not being selfish. Put your mask on first, or you know what? Be selfish. Put your mask on first. Take care of yourself. I don't care that that child is crying. I don't care that the husband's hungry, or I don't care whatever. Take care of yourself. Close the door on everything else. It is you.
I think that's a perfect metaphor. You know, you can't take care of others if you are not there for yourself. We're asking women to get their screening mammograms once a year. Once a year. You can put that much time out there for yourself to make sure that you get these regular exams and that you get checked out early, so that if you find something, you can act on it.
How much does a role to having access to health care play in this as well? Because there has to be that invitation or that accessibility to healthcare to get these screenings that comes into play as well.
And I think that's a critical issue. Having access to a primary care doctor, to a gynecologist, someone you see regularly that's going to encourage you and push you to keep up with those regular mammograms is important. You know, not getting into the habit of that screening mammogram is what lets people get away from that. And you need to have a doctor who you partner with to make sure that you're examining your breasts and that you're getting those screening mammograms.
Now, I understand Emory is doing work with what I think is triple negative breast cancer. What does that mean, and what are the implications there?
When a woman finds a lump or a mass in her breast, or she finds out that she has an abnormal mammogram, the first step is going to be getting a breast biopsy. On that biopsy, if we find out that there is cancer in the breast, we need to do some additional tests to try to understand what kind of cancer it is. Cancers can grow for different reasons. Some cancers like estrogen and progesterone, which are hormones. Some like a protein called HER2. If we check all three of those markers and none of them are present, we call that a triple negative breast cancer. Triple negative breast cancers can be more aggressive, but if they're caught early, they're very treatable. And most of the time, we treat these cancers with chemotherapy and probably surgery and radiation.
Okay, so with the short time that we have left, let me ask you, doctor, what are some of the promising treatments that we have on the horizon?
One of the things that we are looking at in triple negative breast cancer is using immunotherapy. Immunotherapy has had a lot of success in other cancers like melanoma and lung cancer. We'd like to see the same kind of success in breast cancer, but it is still a type of a drug that we're studying. This is a way to harness your immune system to try to attack the cancer.
Oh, wow. Well, I tell you what, I know that there's some promising stuff. That's why I said early on, thank God for people like you, because it really becomes so confusing. Because is it an understatement or an oversimplification to say that really cancer cells are nothing more than a good cell that's gone bad? It just keeps growing and growing and growing and metastasizes into something even worse than that. Is that it?
So, you know, your body's really good ordinarily at checking itself. So if something is growing inappropriately, it gets rid of it. Cancer somehow has escaped that mechanism, and it's a good cell gone bad, like you said.
I tell you what, I thank you. I thank you. I thank you.
Thanks for having me.
You are very, very good. When we come back here, if you think breast cancer only strikes women, well, think again on that one. We assure you it's not the case. You will meet a male breast cancer survivor when Public Affairs on Peach returns.